Hi guys, Dr. Pisarenko here from Plastic Surgery Westchester, and we got some good questions about fats transferred to the buttock or a BBL. So the first question is, can I sit after a BBL? The answer is yes. You really can't avoid sitting. You just have to be careful how you sit and what you sit on. So we usually provide a special pillow that goes under your thighs that really elevates your butt so you don't put any pressure on the butt. And we usually recommend for you to do this for 4 to 6 weeks. But every surgeon is different, so consult with your surgeon. What is the best sleeping position after a BBL? Well, it really depends if you had any other procedures done. But we usually recommend for you to stay off your butt as much as possible. Some people use a wedge pillow to sleep in a beach chair type position to really elevate the butt off the bed. Some people lay side to side and some people lay on their stomach. But the goal is to really eliminate any pressure on the buttock area. Can fat be transferred to hips during a BBL? Absolutely. We're able to target specific areas. Some patients want more projection, some people more width, and we're able to do that at the patient's request. Is a BBL painful? The BBL itself isn't that painful, it's the harvest that's painful. So the areas where we harvest the fat, liposuction areas, those are the areas that patients mostly complain about in terms of pain. How many sizes can you go up with a BBL? It's a very tough question, and it really depends on the patient. Some patients have a lot more fat, some people have a lot less fat. It really depends how much volume we can place into the buttock and also how much the skin can stretch. How long until BBL results are final? That's a really good question and really depends on the patient how much work is done. But usually we say somewhere between 4 and 6 months. And final excellent question is, are BBLs safe? And the answer is they are, in the right hands. You hear on the news and online that BBLs can be a deadly procedure, and that's true in the wrong hands. There are surgeons who are not plastic surgeons, who are not even surgeons, who are not board certified, that are performing these procedures blindly. We do these procedures under the guidance of ultrasound. That means that we're placing the fat in very specific areas within the buttock to avoid the danger zones, to avoid patients having complications after surgery, including fat necrosis, including asymmetry, and some more complicated issues such as fat emboli. When you do this procedure blindly, meaning you inject the fat without any assistance of ultrasound, it can land in the wrong plane and cause problems. You have to make sure that your surgeon is not only using ultrasound, but is also qualified and has done many of these procedures for you to be and feel safe. Feel free to call us at Plastic Surgery at Westchester to schedule your consultation, and we will be happy to help you and keep you safe.